Welcome back. In the chapter of Preventive Medicine and Obstetrics, Pediatrics and Geriatrics, in today's session we are going to discuss about the Baby Friendly Hospital Initiative. The Baby Friendly Hospital Initiative has 10 steps to summarize the policies and procedures which will facilitate the breastfeeding. So we see that the 10 steps include the hospital policies, the staff competency, the skills and the knowledge which is imparted to the staff, antenatal care, wherein you educate the mother regarding the importance of the breastfeeding, care right after birth, that is kangaroo mother care, support the mothers with breastfeeding. In the fifth point, we are going to support the mother with the breastfeeding, followed by supplementation, where no other supplements have to be given and exclusive breastfeeding has to be done for 6 months. And the seventh, there is rooming in. The mother and the baby is kept together. And responsive feeding. The mother has to understand the demand of the baby and breastfeed the baby. Bottles, teats and pacifiers. So we see that what are the disadvantages of bottle feeding has to be told to the mother. And we have a coordinate discharge in the 10th point. So these 10 points have to be kept in mind. First one is the hospital, then we have staff, then mother, educating the mother, and this mother, we educated the mother, now she gave birth to a baby, and kangaroo mother care is done. After giving birth to the baby, she will breastfeed the baby, so we have to support her. Then we have to tell her no supplementation has to be given. So how? In the hospital the staff was taught, then a lady came, she gave you told antenatal care was given to the lady, you educated her, then kangaroo mother care was done, followed by we supported the mother. After the baby was given to the mother, we told her about the breastfeeding. After teaching the breastfeeding, we told her the supplementation should not be given, and then rooming in was done. In the seventh point, rooming in, you kept the baby and the mother together. And then eighth thing, keeping the baby and the mother, you taught her about the responsive feeding. Lastly, the disadvantages of the bottle feeding and the discharge. So let us discuss each of the point in detail, starting with the hospital policies. First point, what did we see, guys? Hospital policies. So we see that the first thing is they comply fully with the International Code of Marketing of Breast Milk Substitutes and the relevant World Health Assembly resolutions. So this baby friendly hospital initiative, they directly comply with the International Code of Marketing of Breast Milk Substitutes, and also with the World Health Assembly resolutions. So we see that they combined with this International Code of Marketing of Breast Milk Substitute, and they said that these breast milk substitutes like Farex and we had Cerelac and so on in her childhood, they should not be marketed, and exclusively breastfeeding has to be encouraged, and these breast milk substitutes should not be marketed. So we see that they compiled with this International Code of Marketing of Breast Milk Substitutes and World Health Assembly resolutions. In the first point, there are 3 sub points. First thing, the International Code of Marketing of Breast Milk Substitute, World Health Assembly resolutions. The second point, we had written infant feeding policy. We see that in the hospitals they had written infant feeding policies. The infant feeding policies were written, and they have to be communicated to the staff as well as the parents routinely. This policy, the breastfeeding policy, infant feeding policy has to be written and pasted, the chart or whatever has to be pasted, and they have to be communicated to the staff as well as the parents. Followed by, we have to establish a monitoring and data management system. A well established ongoing monitoring and data management system has to be present in the hospital. We have to manage the data and the monitoring system has to be there. So this was the first point. Under the hospital policies, we had 3 points. What were the 3 points? First point, International Code of Marketing of Breast Milk Substitutes and World Health Assembly. They should comply fully with them. In the second thing, written infant policies has to be done, and they have to be communicated to the parents as well as the pregnant mothers. And the third point is that we have to have an ongoing monitoring and data management system has to be present in the hospital. This was about the hospital policy. Next, first one is in the hospital. Baby friendly hospital initiative. First, it deals with hospital. Second, staff. To the staff, what do? They ensure that the staff will have a sufficient knowledge, the competence, and the skills to support the breastfeeding. It's not like, okay, now a pregnant mother comes, she will ask one of the staff of the hospital regarding the breastfeeding, and he has no knowledge about it. Then it won't be a good. It's not, right. So we have to teach the staff. We should impart the knowledge, skills, and competence for the breastfeeding sufficiently in the staff. Followed by, discuss the importance and the management of the breastfeeding with both the pregnant mother and their family. We have to inform the pregnant women as well as their family regarding the importance or benefits of breastfeeding. In under the antenatal care, the staff, first what happens? The hospital should have the policy. Second, the staff has to be taught. You're teaching the staff the skills, the knowledge regarding the breastfeeding. And now, once the staff is ready, when the pregnant mother comes, the staff will teach the pregnant mother the importance of breastfeeding, and also the pregnant mother and her families have to be, taught about the breastfeeding benefits. Followed by the kangaroo mother care. We see that we have to facilitate an immediate and the uninterrupted skin to skin contact, and we have to support the mothers to initiate the breastfeeding as soon as possible after the birth. We see we have to motivate a skin to skin contact of the mother and the baby. The fourth point, so the pregnant mother who had come, in the third point we saw the pregnant mother antenatal care, you told her, and the mother has delivered the baby, and this baby, the kangaroo mother care has to be done with the mother as well as the baby. Okay, so and how fast the breastfeeding should be initiated? Within 30 minutes or half an hour in cases of normal delivery. Next, in the fifth point, after doing the kangaroo mother care, we have to support the mothers to initiate and maintain the breastfeeding, and also if any common difficulties arise, we should teach her how to manage them. So in the fifth point, we show the mothers how to initiate and maintain the breastfeeding. Last, sixth point of this slide, exclusive breastfeeding. We saw no supplementation, no fluid, no food has to be given other than the breast milk for a period of 6 months until it is medically indicated. Now the mother can't say. The baby friendly hospital initiative have said that on 6 months only breast milk, so I will not give the medicine to the baby in water. She cannot do that. If it is medically indicated, she has to follow the instructions of the doctor and give the medicine using water or whatever the doctor has told. Let us first summarize the 6 points and then move forward. First, the hospital policies in the first point. Second, we educated the staff. Third, the staff did the antenatal care. She taught the mother regarding the benefits of breastfeeding. Fourth point, this mother gave birth to the baby, so kangaroo mother care was done. Fifth point, the mother will not know how to breastfeed the baby because she's a primey. Let us consider she's a primey. She will not have the knowledge. No coaching, nothing is being taught at home. Such things the doctors and the nurses, A&M have to teach them. Fifth point, we have to support the mothers how to breastfeed the baby. Sixth, you have to educate her regarding the supplementation. Clear guys? 6 points are Perfect. Moving on to the seventh point. Practice the rooming in and allow the mother and the child to remain together for 24 hours a day. Followed by the kangaroo mother care, skin to skin contact was done. Then, next step, what we have to do is to remove the anxiety and fear the mother will have. Where is my baby? Where is my baby? The fear always. Somebody will take away my baby, or the baby wants me. That fear will be there if the mother and the baby is kept separate. So, we have to make sure that rooming in as soon as possible, that is 24 hours a day, the mother and the baby should be kept together, so that any time the baby can breastfeed, the mother can breastfeed the baby, and on demand the baby can be breastfed. Next, encourage the breastfeeding on demand. Mothers should recognize the infant's cues for feeding. So, the baby will make this specific sound when it is hungry. So, we have to help the mother to recognize this infant cues, what the hints it is giving that it is hungry. We have to, teach the mother to recognize this sound and breastfeed the baby on demand. Followed by counseling the mother the risk of feeding bottles, the teats and the pacifiers. She has to be taught what are all the risks. We know lots of E. coli infections can occur. So we know that the breastfeeding is the best method because no infections can occur from the breastfeeding. The World Health Organization says that even if the mother is TB infected, she can breastfeed the baby. So such important the breastfeeding is. We also studied regarding the breastfeeding in the previous video, so you can see what are all the benefits we have, and we have to counsel the mothers what are all the risks which are arising because of this bottle feeding. Next, last we have coordinate discharge. So what is this coordinate discharge? We have a coordinate physician or our doctor who is responsible for our discharge. One physician or one doctor should be responsible for our discharge, so that any time any support or care which is required, the parents and the infants will have an access to it. Okay, the coordinate discharge has to be done so that the infant as well as the mother can have an access, they can have an access to the ongoing support and care. Okay, next there was an MCQ which we found in the previous question paper. This mother friendly childbirth initiative was found in USA. Mother friendly childbirth initiative. Now we have baby friendly hospital initiative. Here it is mother friendly hospital initiative. This is childbirth initiative. This was found in USA. This was an MCQ. So let us check if we have any other MCQs. Yes, we have rooming in. The mother and the child should remain together for 24 hours a day. Okay, this was another MCQ which we found. Rooming in, and yeah, the breastfeeding has to be done as soon as possible. How fast in cases of normal delivery? Within the 30 minutes or half an hour in case of normal delivery. Exclusive breastfeeding, we see that no food or a fluid other than the breast milk has to be given for a period of 6 months. Okay, so this were the MCQs which were found. Let us summarize. The baby friendly hospital initiative was initiated with combination of World Health Organization and UNICEF. Do not forget that this was created and it was promoted by both World Health Organization and UNICEF. They proved this baby friendly hospital initiative was highly successful in initiating the breastfeeding practices. And what did they do? They had a package of policies and procedures which facilitated the newborn services and maternity services, and which supported the breastfeeding. And those 10 policies and packages we have studied, which were summarized in 10 steps. What are those, guys? Let us summarize again. Hospital policies, we had 3 subdivisions in that. And staff competency, the skill and knowledge has to be given to the staff. After teaching the staff, she will educate the mother. Then this mother will give birth to the baby. Kangaroo mother care is done. After the baby is given, you have to teach her regarding the breastfeeding and tell her no supplementation has to be done. And in the seventh point, you have to keep the mother and the baby together so that anytime she can initiate the breastfeeding. And also teach her if the baby infant cues has to be recognized, and she has to breastfeed the baby on demand. That is 8th point. 9th, you have to tell her what are the disadvantages of the bottle feeding. Lastly, coordinate discharge so that they can have an access to the ongoing support and care. So this was regarding the baby friendly hospital initiative, a very short topic yet very important one. I hope everything is clear. If you like my video, hit the like button and subscribe. Thank you.